Hi guys, welcome back to my YouTube channel. So we are going to focus on the osteology of the humerus, and knowing that the humerus is the longest and the strongest bone in the upper limb. So we're going to study this humerus here in three parts. So we're going to look at the proximal part, we're going to look at the shaft, and we're going to look at the distal part. So we're going to look at any anatomical structures of these regions. So now let's look at the proximal part of the humerus. So this is the proximal part of the humerus here. So what are the features that we can see in this proximal part? Firstly, we're going to see this area here. So this is called the head of the humerus. Okay, so if you look at this head is pointing posterior medial. Okay, meaning that it is moving towards the posterior side and it is located at the medial side. Okay, so this is the round head, posterior medial head, okay, of the head of the humerus. So this head of the humerus here is articulating with the glenoid cavity of the scapula here. Okay, so this head and the cavity here, glenoid cavity, will form what we call the glenohumeral joint. Okay, so when you look at these joints here, you find out that the head of the humerus here is much bigger than the glenohumeral cavity. This gives it a kind of morbidity that it can undergo circumduction. So one of the disadvantages here is that it is giving it instability, meaning that it will be prone to dislocation. Okay, good. So another structures that we are going to look at is this region here. So this area here is called the anatomical neck. So this anatomical neck is demarcating the humeral head and the tubercles. So this area here is called the anatomical neck. Okay, so when we move down, we'll see two kind of tubercles, two kind of protrusions. This one that is located at the lateral side and this one that is located at the medial side. So this one that is located at the lateral side is much bigger, so we'll call it the greater tubercle. And then this one that is lesser, located at going towards the medial side, we'll call it the lesser tubercle. So this greater tubercle here, it contains three kind of seat muscles, rotator cuff muscles, which are the supraspinatus muscle, infraspinatus muscle, and teres major. Why this one here, the lesser tubercle here, will contain muscles like the subscapularis muscle. So in between this tubercle here, we have a kind of groove, a canal. This groove here is called intertubercular sulcus or intertubercular groove or biocipitral groove. So there's a muscle that passes through this groove here, and that muscle is called the long head of the biceps brachii. Okay, so we have another kind of structure here that demarcates this that divides these tubercles from the shaft. So this structure here is called the surgical neck of the humerus. Okay, so this is the surgical neck of the humerus. So as the name implies, surgical, it means it is the most prone area of the humerus that is more incident of fracture. So this area, the surgical neck, is prone to what? Fracture. And this area is being wrapped around by axillary nerves. So if there is a fracture here at this surgical neck, it is going to impinge or damage the axillary nerves. Okay, good. So let's look at the shaft of the humerus. So from here down here is called the shaft of the humerus. So what are the things that are found within this shaft? So this shaft, this area here is called the deltoid tuberosity. That is where the deltoid muscle inserts. Okay, and then when we look at the posterior aspect of it, we are going to see a kind of diagonal line here. So this diagonal line is also called the radian groove. So within this radian groove, you cannot be able to visualize this. Okay, within this radian groove, it contains the radian nerve and the profundus humeral artery. Okay, so damage at this shaft here is going to damage the radian nerves and the deep humeral artery, also known as the deep profundus humeral artery. Okay, Good. So as we are moving down, we now see a kind of ridge-like structure, a kind of continuation of this bone, forming a kind of ridge, both at the medial side and the lateral side. So this is called submedial. So this is called the lateral supracondyle ridge, and this side is called medial supracondyle ridge. So this lateral supracondyle ridge will come to this area and thicken anterior in position. This is called the lateral condyle. Okay, why this supracondyle ridge will continue here to form what we call the medial condyle. So this is the medial condyle. Okay, so posterior to the medial condyle, there is a groove here for the ulna. So the ulna is going to wrap around this area here. So this is the groove and ulnar nerve. Okay, and then this lateral supracondyle ridge has attachment for extensor muscles of the forearm. This area has an extensor muscles of the forearm. Okay, so now let's look at the distal part of the humerus. Okay, so at the distal part, we're going to see different structures. So one, we are going to see this protrusion here. So this is called the capitulum. The capitulum. This is called the trochlear. The trochlear. This is called the medial epicondyle. This is called the lateral epicondyle. So superior to this capitulum here, we have a fossa here. So this fossa here is called the radian fossa, while this one here is called the coronoid fossa. Okay, so when we turn to the posterior side at the distal part of the humerus, we are going to see this big fossa here. This is called the olecranon fossa. So this is a deep depression located on the posterior surface of the distal humerus. Okay, so this depression here serves as a receiving cavity for the olecranon process of the ulna during full extension. So this fossa here is the biggest among all the fossas located in the distal parts. Okay, so let's quickly talk about the muscles that are attached on the humerus, or from the shaft, on the shaft of the humerus. So when we look at the proximal part, we are going to see that intertubercular sulcus here has a lip. Okay, it has a lateral lip and it has a medial lip. So on these lateral lips here serve as an attachment for pectoralis major. This medial lip here serve as an attachment for the teres major. In between these two lips here, this is where we find the acetinous dorsi muscle. Okay, so anterior to this shaft here, there are a group of muscles that can be found on this anterior shaft. We have the brachialis muscle, we have the biceps brachii muscle, we have the coracobrachialis muscle that also attached on the anterior side. We also have brachioradialis muscle, okay? And when we look at the posterior side of it, the muscles that are attached on the posterior side, we have the triceps muscle, both the medial and the lateral head of the triceps muscle. Thank you very much for watching. Please, if you like what we are doing, you can encourage us by subscribing, commenting, liking, and sharing our video. Thank you, and see you on the next video.